So I get this question often, and people often misrepresent my position. So, first of all, I do see what Dr. Guterson sees, but it's rare. I see it as a rare condition. And I see when we use various forms of drugs that I see them as emergency medicines, as tools. Now, where my mind, my curious mind, as a scientist who's a seeker of truth, what I say is bipolar is only a description of something we're observing. It does not give us information on what is the underlying cause. So I don't agree that there are such things as psychiatric illnesses. There are symptoms where we have not evolved to understand their causes yet. So I want to know what you believe are the potential medical causes to someone who might present with that type of symptomatology. For example, what we label as mania, and it can become delusional, where someone would want to get on a plane and go meet with the Queen of England.
We do know that people who have, for example, calcium issues from their parathyroid can begin to be manic, can begin to be psychotic. So absolutely, when somebody comes in the hospital, we do the blood work and take a look at it. Thyroid conditions as well could. There could be certain brain injuries that could result in what appears to be manic-like symptoms, not necessarily, and so we could look at that. Urinary tract infections, especially in the elderly women, can sometimes come out as appearing to be manic. And then the question is, do we throw lithium at them? The answer is no. No way. You don't do that. You look at what's going on medically and you treat that first and foremost. That's the first law in psychiatry, is there some physical medical thing behind it? Do they have Lyme disease? Do they have hypothyroidism? Do they have a tumor in their brain? Seizure disorders, all those things, substance abuse issues. So
what has happened then? Because we don't get that from our modern psychiatrist. I'm very well connected and attuned to what's happening in corporate medicine. And so no longer are psychiatrists taking that investigative stance. I'm a medical professional and I want to rule out conditions, right? So you said the first law of psychiatry, really, it's rule outs, right? If there is some medical condition that's influencing the symptomatology, as a medical professional, as a physician, it is my responsibility to be able to investigate what has happened where that is now eliminated and people are just receiving the diagnosis in 15 to 20 minutes, sent home with a prescription. And when they go into inpatient care, they're not even receiving a full battery of medical tests.
I'm not sure if I agree totally, because when people go into an emergency room, they went to the emergency rooms of the hospital I was worked at, they would receive blood work. It would be looked at. I do think that, at least I hope, that most psychiatrists do first and foremost look and see if there's anything medical going on. I think the problem is once they eliminate that there's something medical going on, then they jump and say, okay, this is bipolar, this is major depression, this is psychiatric illness, and therefore, the cure, the treatment is to throw lithium or Depakote or Lamictal or Prozac at them. And they don't take the time to look at the larger matters that are going on. Now, the reason behind this is because, look, I'm an old guy, okay? So I went to medical school quite a while ago. But think about what it takes to become a psychiatrist. You have to go through undergraduate. You have to take 2 years of chemistry, 1 year of biology, 1 year of physics, mathematics. Then you go to medical school, where you don't spend much time in the world of behavioral sciences or psychiatry. You're learning anatomy, physiology, biochemistry, all these things which are important. So if somebody is interested in the human journey, they're not a scientist, they're not even going to get into medical school in the first place. They're going to get weeded out. And then the ones who go to medical school, who are doing well and are interested, they're much more interested in other areas. So to get to the point of the 8 years of undergraduate medical school, to get to that point, and then to want to go into the world of psychiatry and not be oriented toward the science of the brain is few and far between. I'm lucky. I think I got lucky. I got through it. And I mean, the first day of my residency at Western Psych, they had us all there. Why are you here? I'm interested in researching the frontal lobe. I'm interested in researching the amygdala. I'm interested in this. I said, and I became a marked person, although I got along with everybody. And I said, I'm here because I'm married. I've got kids. I got a family, and I want to be here because there's a great community here, a great Jewish community where I want my kids to go to their schools. And here I am, and Western Psych accepted me. So here I am. And so I had a whole different outlook. But most people, when they get to this point, they're very scientific, and they don't know how to relate to the patients. They don't know how to stop and pause and really listen, because listening is key.